Good evening. Welcome to Healing Quest. I'm Deborah Arneson, your host for tonight. We have a great show once again for you. We have back once again this evening for you Ann Richmond and Marty DuBois, and we are here to talk about neurofeedback, which we talked about a bit last week in regards to women and adults, and today we're focusing on ADD, ADHD, and autism in children, and assessing correctly, and diagnosis, and what this protocol does to help your kids and to help you as parents help your kids without drugs. So this is a very exciting show, and we can't thank you both enough, and your mission in life is just such a wonderful, blessed mission to help parents and kids really get off drugs or stay off drugs and to be assessed correctly, because so many kids are not assessed correctly. Am I correct?
Usually.
Yep. And you find I know we were talking earlier that depression and autism kind of, or ADD, I'm sorry, depression and ADD kind of cross over in some of the symptomatologies.
Absolutely.
What are some of the symptoms of ADD?
Well, the classic symptoms of ADD are being disorganized, being distractible, and being impulsive. And some of those symptoms can be seen also of children who are anxious or children who are depressed. Different.
Or kids who eat too much sugar, maybe?
Yes.
Yeah, that's possible
Okay.
too. And all, you know, in various combinations of those things, actually.
Also, it's also evident in a lot of children who have seizure activity or learning disabilities, or if there's some kind of brain injury. So the symptoms are there, and sometimes people just think it's attention deficit when there's other underlying issues that may not have been diagnosed.
So tell me about autistic children. How do you work with parents who have autistic children? That's got to be tough.
Well, it's a team effort, I would say.
It definitely is a team effort.
It is a team effort. The children are very sensitive and often have a hard time with new situations. So we have to be very careful to try to make sure that they feel comfortable in our office, and we've worked with children for a long time, so in general I think we do a pretty good job with it. They vary, though. The children vary a great deal, so sometimes sometimes it's very easy. They're just very cooperative, and they don't have any problems. Other times it's kind of a challenge, I guess I'd say.
So are you seeing a huge growth spurt in autism and ADD and ADHD?
We're seeing a lot of children who are autistic,
More and more?
They're across the spectrum. A big group of the children have language issues. You know, parents would like them to be able to speak more appropriately or to speak all together. So that's an important part, and we are able to achieve, some of that. A lot of children with autism are just so hyperactive, and they're on so much medication, and we have to work with that. And like Marty said, they're very sensitive. So you give them a little bit of medicine and the neurofeedback, and sometimes they'll get more hyper. Our one mom, within the first 10 sessions, dropped the medication by 15 milligrams.
That's wonderful.
So she was able to, so there's all these issues. And with some of our kids, we're able to, we like work in 10, 15-minute segments, and that's all they can handle, and
Because it's too much stimuli.
Right, and
can you
change-
actually put the electrodes on them and accomplish the tasks without the child participating with the neurofeedback?
Most of them are pretty.
Well, sometimes they don't like the electrodes, but as far as once we get the electrodes on, yes, I mean they don't have to know exactly what they're doing, basically. They just have to, we have to instruct them that we want them to keep the sound beeping or whatever the sound is that they're listening to. And that's enough that the brain sort of takes over
Ah,
subconsciously.
so they just watch and fixate then? and
Well,
start working
sometimes,
it?
or sometimes they occasionally they do other activities while they're still listening, and it keeps, and it seems to continue to work, actually.
That's wonderful. What age range do you work with kids?
Well, we've started I've worked with as young as 2-year-old. Right
Really?
now we have a couple of 4-year-olds.
What would you do with a 2-year-old?
Basically the same thing,
Behavior
Mom.
problems? Or?
Well, yeah, kids who are crying a lot, who are, colicky, or somehow the moms and, parents know that there was some, maybe birth injury.
Or injury from vaccines or whatever?
Yeah, right. And so
And
they'll-
sleep issues is another
Yes,
big one.
some kids just don't
Sleep. Ooh. Ooh.
Right.
Not good for anyone,
No,
including baby.
no, right.
Yeah, and we wish the parents would actually do the neurofeedback also, so that they could recover from the stress of having a child so difficult,
So it really helps
Sometimes
with
they do.
sleep patterns too.
Oh, absolutely.
That's wonderful. Huh.
Sleep.
I actually sent a girl to you as a stewardess who hadn't slept in like 30 days. She came into my clinic. She was a train wreck.
Oh my goodness.
She was a train wreck. She had some kind of virus or something and couldn't sleep. Never recovered from the virus. So we did Shirodara on her. And I gave her calcium, magnesium, 4 of it, and I gave her Calmatrol and Rescue Remedy, and she slept for 2 days. But then she got back out of the cycle, because flying
Okay.
back and forth across the continent really upset her clock. So I don't know if she ever called. But yeah, that's interesting. Do you work with infants?
Well, we haven't, but we know of other people who do, or who have one or two cases, and we have heard of a person that sounds very intriguing, that they worked with the mother who was holding the infant,
Right, as a surrogate.
and they received the neurofeedback, and they were so calm. The mother was calming themselves,
The energy,
so
yeah.
the child became a very calm baby.
Isn't that
Actually,
great?
yeah.
How wonderful.
So it would be fun. We haven't done it, but we'd love to work with people who have colicky infants or something like that in that way. So
Okay, so we're putting on a call. It's an APB for colicky infants, folks. Give us a jingle, and I'll let you know how to find and Marty. So when you work with pregnant mothers, what happens with the fetus?
Well, that's pretty much what this was about, is that the mother was under a lot of stress. And
While pregnant.
besides pregnancy, there were other issues going on, and she came for the neurofeedback treatments. And when she finally, and they could feel that the baby that had been kicking and doing it, having an awful lot of activity, suddenly calmed and moved
Isn't
in a
that
calm
great?
manner. And then after she was born, she was a very calm child.
Isn't that wonderful?
Yeah,
Wow.
so we
So everyone should come see you while they're pregnant, that's for
colicky
sure.
babies, for sure.
Oh my gosh.
And pregnant moms, right?
What are the effects of ADD and ADHD on the child?
well, the child, first of all, of course, oftentimes they have some sort of problem in school, paying attention and accomplishing what they need to do. But it goes beyond just school. I mean, that's often what brings them to us. But often they also have problems getting along socially with because they're impulsive, and they that's a big problem. And then it sort of gets into self-esteem and that sort of thing. So that
Well, how do you assess them? I mean, what are some of the signs and symptoms tried and true of ADD, ADHD? Are there like 4 markers that are always there? Or
Well,
3?
Our job basically is not to assess particularly. Most of the time, by the time children do come to us, they have been assessed by a neurologist or
But
other
let's say
doctor.
some of our viewing audience has no idea if their kids have ADD or ADHD, and they're having trouble in school. What could you say to us right now that would be some signs and symptoms? Are there clear-cut signs and symptoms, or are they variant?
I think there are signs and symptoms that are important to address, whether it's because the child is ADD or depressed or some other thing.
Or stressed.
Right, exactly. We're not sure, but just by knowing what the symptoms are, you know, like because they can't focus, because they can't finish their work. Those are good signs that might be ADD. But the whole issue is it's a problem. Whether it's ADD or depression, it's still a problem.
Right, or stress.
And so one thing we do is we kind of we look to see, is there an pattern of over arousal or under arousal, or some sort of inability to control their
environment.
themselves. Yeah.
Right.
Well, not pretty
Control.
much their own within themselves. And that, plus we also do a sort of I guess we call it a mini map or an assessment, a brainwave assessment, and we can get some clues as to where the problem may lie. If, for example, there's an imbalance on the right and left, in the right and left prefrontal area, we might suspect there's some kind of vulnerability to depression or something like that. If not, then maybe not. So there are certain things that we can do by looking at the brain waves around in different areas to help
That's
us
great too.
figure
So
it
there's
out.
no textbook classic, like just generic diagnosis. You guys are very user specific when you work with kids and adults.
There is
to
no
help
blood
assess.
test or anything like that that could say, okay,
It says
this is
this is
ADD.
it. Right.
What medicine does usually is they say, well, if Ritalin works, that means it's ADD. If not, it's not. It may not be. You know, that type of thing.
I
But
was reading up on Ritalin about a year ago, and I found out that Ritalin is carcinogenic. Causes
There's
cancer.
been some articles about that.
Causes cancer in kids' livers. That's horrible.
Yes.
I can't believe that so many kids are on the darn drug.
Well, they've developed a few others, so
I'm sure they
but
have.
we don't know what
what the
what
effects
happens.
are.
Exactly.
Well, we don't
Especially
know
in
the
little
effects.
tykes. That's too
Right.
bad. So what are the effects of ADD and ADHD on the parents and family?
Well, that's a big one.
It's a broad one, broad answers
You know, parents feel like failures a lot of times. Outsiders who don't know the child will say, what a poor parent this person is. Look at can't control the child, you know, and so, you know, feel they haven't disciplined the child appropriately, and those factors are not true. The other thing is that a parent will feel very disappointed in themselves. Why, you know, why has this happened? Why can't I control this child? They'll possibly even be disappointed in their child. You know, why is this kid
So much for
behaving
bonding,
this
huh?
right? Yeah.
Tough.
They certainly didn't expect to have a family that was this chaotic, you know, that's pretty
Right.
much, and so difficult. And it's hard to see that, especially after years and years of trying to deal with it unsuccessfully, a lot of times the relationship is
Deteriorated.
pretty deteriorated, yeah. And it's too bad, you know, that they couldn't have maybe found something earlier. Sometimes they try, but it isn't.
Doesn't, yeah, that's tough. So it just really wears away at the core, the fiber of the
Right.
family
And a lot
unit.
of times the siblings also are affected, you know, very significantly because they're not getting as much attention as
Right.
the affected child, and they
child.
feel left out, and they're sometimes embarrassed by their sibling, you know, the sibling's behavior. So there's a lot of, you know,
Interplay.
things, right, a lot of interplay going on.
Now, what are